Millions of people live with chronic pain. The CDC now says it affects about 21% of adults in the U.S. And doctors say people who have chronic pain are also at a higher risk for depression and anxiety. Marty Salt explains.
Chronic pain, depression, they are among the most disabling conditions worldwide. Many people struggle with both.
About half the people with depression have some pain symptoms, and about half the people with pain have some depression symptoms.
This can cause a vicious cycle. For example, people dealing with pain often don't sleep well, which affects their mood, which can make them vulnerable to depression or anxiety, which can then increase a person's susceptibility to pain.
Anybody who's suffered from chronic pain knows that it just takes over, and the same with depression.
Dr. Kurt Kroenke says when someone visits a doctor for chronic pain, it's important for the patient to discuss any psychological symptoms they're also experiencing.
In particular, trouble sleeping, no energy, trouble concentrating.
Kroenke is the creator of several widely used questionnaires that help doctors easily measure severity of pain, depression, or anxiety.
So this is a way of saying, your blood pressure's up, except your depression score's up.
Kroenke says it's important to identify and treat both to end the negative cycle. Marty Salt, WGEM News.
And when someone is dealing with both pain and depression, treating one can sometimes help lower the symptoms of the other. In other cases, a combination of treatments might be needed.